two. Take two.
Yeah. After a short intermission because of the power outage at the Iroquois County Administrative Center, and at 9:45, we're trying to have a health committee meeting, and we do not have a quorum, so we will be doing no official business. We will be proceeding with discussion and offering of information, and we will pass the claims on to the Finance Committee. However, we will later look at the claims for a recommendation to the Finance Committee in general. So at this point in time, are there any public comments? Seeing none. Agency reports. I guess we have none except public health. So let's jump to the Iroquois County Public Health Department. Dee?
Thank you. Good morning.
Good morning.
First thing that I would like to take a look at is the report. You know, we're going to public health fires that will also partner with the annual report immediately after the fiscal year end to IDA. It's also that we make it available to the public. We do not have to publish it there. We have to have it available if anyone asks for it. So we'll have an extra copy at the health department, and I will make sure that copies go to the board of health tomorrow night, and the on board with the board meeting. Our annual report is from the period of July 1st through November 30th, 2014, 5 periods. Actually, we were given information to forego some of the requirements of the annual report, but we chose not to do that. I want to get out of the commitment. I want to present what we've done in the 5 periods of time on organizing. So I make sure that it's a lot of requirements. We did notification yesterday from the Warren at the state level for IDA. They reviewed it very briefly, but had nothing that made it come.
Dee, is that something that's officially filed at the clerk's office also?
No.
Or?
I got it. It does not have to file the clerk's office. No one has to be available. So that if someone comes in and asks for it, we can give it to them and give them our number without delay. So, and we present them a state needs certification.
Okay.
I have a question.
Yeah.
On some of the numbers, the hepatitis B, those are 2 cases that were reported or 2 cases that were documented? And then my next question is, how often do you need to get that vaccine?
Okay. So for any cases, those are cases that we have investigated.
Okay.
Investigated case and the cases that we not okay.
Okay.
So those are actual investigations, not cases.
All of these are investigations?
All of them are
Okay.
investigations. But what do you have?
The hepatitis B. I just remember when I moved to Germany, I had to get that vaccine. So you.
And then the third vaccination is not first dose. It's just survive by lifetime.
Oh, lifetime. Okay. So you don't have to get it again.
No. Approximately, and I remember the statistic correctly, and I think I'm correct on it. 99.6% of the population are in for life. One thing is and 3 dose period. The other 0.4% of the population may need a booster if they're significant, we can consider or not.
I just remember. That's so we could go with that, you know,
I'll answer for you, you can ask, I don't know. Too much information on that, that we want to put everybody we have to ask, and we would go over the annual report, or if you get that. So we would be looking at you test that, we'll give you a number of tests that were good. But if we're going to use it at one test, that's right? Well, let's do it's two TB tests, so you double it. And then it's a little extra. So everyone was got part of that. So that's the annual report. February, I attended an administrative training in Springfield. That was done by the Illinois Association of Public Health Administrators and Illinois Public Health. Very training. They went over most of it. I knew some about, but I learned a lot. They went over statutes and codes, certification regulations, and meet certifications of their expectations. And deadline. So it was a very training, and I was appreciative to be able to go over that. On February 19th was the Illinois Association of Public Health Administrators general meeting, and at that time I had the opportunity to conduct a state public health department director, and chief of staff Gary Raymond, and he gave us a vision for what changes would be happening at the Illinois Department of Public Health. I got a lot of changes to happen over the next year or so. It was an opportunity, air training, airport training, but this is the new state department director of staff, grew up here in Fort County, that's Mayor Raymond, the brother. And then we had, at that time, we went over the code changes, funding, that was done today, the governor took budget, and they went over changes, proposed changes, funding for IDH, the CHS, for ICOA, Illinois Baby, and some of the proposed things that are now non-final, and I can certainly give you a good overview of what things are like. But program that for your quick income health department could be the tobacco program. It's an across the board code 2026 that in the local health department for tobacco prevention role. Illinois breast service is probably our friend that hits the hardest. Right now, we say that there's code 711 is statewide. There's governor's budget gets that program from over between 33 and 44 million down to 4 million statewide. So that's one of our programs that made, that's on track. We only ran some that's on track from Lewis County. They're the agency that we left our contract and for service. So they Lewis County only ran for the only cancer for the area. So we'll have to wait what county says you or what like some of that small amount of money or how that play out. But like I said, they're all co-coaching, so you won't have any final numbers for I don't think you guys like it.
Is Susan G. Coleman still sending you money?
They're not yet.
Okay.
That's kind of how it went for quite a year.
So when we stopped fundraising for it and going and walking our 60 miles, they stopped giving us money.
Yes, that's correct. Full health program training, the effect that statewide, there's a 10% cut on some of those. But I think what that would be, and you're definitely good in mind, but from the information I've been given, it's probably the school-based health centers, having school-based health centers in the So it may not affect us. Now, our coordinated school health grant was a grant that we got in 2004. It was supposed to be a 3-year grant. So we've had the grant for 12 years. Even if the state refunds that, I'm not sure that we'll be eligible next year for that, but we're still going to try. They've been using us as one of their federal pilots, but our numbers are really good, and they're pleased, and they're looking to expand that into other areas of the state. So there may be an opportunity for us to receive some funding for contracting to help implement that in other areas. So we'll see. But other than that, those are really the only IDPH grants that will affect the health department. All of our other grants should be stable. Local health department, local health protection grant funding came in funded level. So we were really happy about that. Because at one time they were talking about 20%. For DHS, what we were told officially and all the official documentation that I've been sent says that it's going to determine. We know that DHS is probably looking at somewhere around, an 8% budget cut across the board, across the state. Well, which programs DHS will decide to fund and which programs they won't fund has not been determined. It sounds like with Fairness Case Management and HFI, the 3 programs that we subcontract to IMH look like they're going to be in pretty good shape and shouldn't be affected. So that's our hope at this point. As far as the Illinois Department of Aging, we know that the CCP program, the Community Care Program, that they're changing some of the qualifications for services. So our numbers may change a little bit based on their qualifications and how those change. We're not sure how the funding will end up, but we've been told that the Adult Protective Service program won't be our funding, so that's good. It's very good for us. So you look at your grants and contracts list that I couldn't send you. It's actually the same one that I gave you last month. We haven't had any new grants in the last 30 days that we've had to apply for. Most of those grants are going to be due for fiscal year 16, probably at the end of April and beginning of May. And at that time, we'll spend every day working on grants because they'll give us, a 3 or 4 week notice and then a deadline, and we'll spend that month, at least about a 4-week period, getting all those in. The next piece of paper that I gave you was the program summary report that goes through the environmental health services, the community health services, the social services, and our numbers and where those are at. And if you look at that compared to the annual report, that will give you an idea, at least a snapshot picture of what it looks like and how different services increase in the fall and kind of drop off in the winter, and which ones pick up, vice versa. Different programs have their season. So I think our numbers are pretty diversity in the number of programs that we offer, and we're also surprised by the number of people who the health department serves. So that would be a good snapshot. As far as subcontracted services, at Deerfield Memorial Hospital, I met with them last week, and we have a meeting again on Thursday. The contract, we're looking at some contract language changes for the subcontracted services, but no major changes, just little ones that satisfy them and satisfy us. The weight numbers are up. Their caseload is currently 516 and their assigned caseload is 619, so they're functioning about 83%, which is still really good, considering we came over at about July with them having about a 70% caseload. Human case management caseload The assigned caseload is 232. They're currently at 197, so they have an 85% caseload. So that's seen a big increase since July. HFI, the assigned caseload is 31, and they're currently at 29. And then they have one that's on suspend that they think will be released pretty soon. But so they're running anywhere, with one number difference, anywhere between 94 and 97% of caseload. That's pretty good. I really don't think at this point in time we could ask for better. We have a DHS site visit on March 25th and 26th. They'll be sending to the UNH site as well as the health department and looking at the program and how we're functioning. I have had several meetings with the people who will be doing the site visit, getting their expectations. This is new for them as well because we're the first health department in the state to subcontract those services to a hospital. So it's a learning process for all of us. So the audit should be very interesting. And they've asked for some documents ahead of time in preparation and the call and ask questions about how the subcontracting is working and
Did the hospital hire the people that were working for you before from WIC to go over there?
yes, they're hospital employees.
Okay, so now they're not in our pension system, they're in the hospital.
Right,
Okay.
right. They're hospital employees, and there are currently 7.
Really?
Might be 8.
I just want to let you know, because, people tell me. So the clients are really enjoying going to the hospital as opposed to the health department because the stigma and everything is gone. People are just assuming they're going to the hospital for a hospital visit, and I think that's been a good thing
Yeah,
in our community.
The feedback that we've received at the health department, because they still come here for their immunization,
Mm-hmm.
has been very positive. I think that one of the huge benefits is that a lot of these people sign up for WIC or family case management following the birth of a baby, and with the staff right there, they can go right up to OB, sign up before they leave the hospital, or they can stop down at the site right before they leave, and they don't have to make additional trips with the newborn. So I think people appreciate that. I know that the staff over there have worked very hard and very diligently to make sure that there was no interruption in services, that things are going smoothly, and that the people members are up, that people are being well served. So I think it's a win-win.
And it's one of my favorite programs. I think it's a program that we need. A lot of people, it's not, yes, a level of so-called welfare, but there's limitations and restrictions on it, and I just think it's too bad we can't model our link card after the WIC program. Yeah, good job.
HFI is currently they're working on their accreditation. They will have their site visit for accreditation next year, April 10th through 12th of 2016. So they have a little over a year to become accredited and to have all that in order. I have no doubt that will be very successful. So that's how this is going now. And then the last thing that I wanted to discuss with you, I know at the last meeting, Terry did a long in service regarding the environmental health programs and what they do and how that affects the residents of the county and what they're looking for. So I wanted to know if you would like more of those, and if so, if you just want to look over the annual report or the program summary report and pick programs that you'd like to hear about, let me know what you would like to hear about, and I'll have either myself or one of my staff members give you some information. Everybody.
I think that'd be a good idea. I approached Dee last month also about some short blurbs for the whole county board as far as the operation of the different programs, etc. I don't know how, in my mind, it can't be all that long, but maybe short and often type thing that could be offered. It's certainly, the involvement of the county board now is a lot more advanced than what it has been in the past with Fort Iroquois. And I think an educational process would actually be a good thing for the county board members, not only for the health committee. Probably short blurbs for the county board, and probably more in-depth explanations for the committee level might be in order. I don't know enough about it to be able to suggest one way or another how deep or how far. That would be probably in your purview much more than anybody else's, but that would be my thought. Does the committee have any other thoughts?
I would like to see maybe have a short presentation on the adult protective services, mainly because we've had, legislatively we're working on some issues in our county. Maybe in the next few months, you can let Luann let her know that it's gone to the bill writer. And I think, a lot of people in our community, they don't know that some of that stuff is happening, and if they do, it is happening in their families, that there is help and resources, and I think that would be a good one to get out there. Even to our community, it'd be great to maybe have the newspaper even do an article on our Adult Protective Services program. I don't think people realize how well staffed and how well, it's a good program. So.
We love talking about it for your staff.
I know.
We really do. So,
And your staff has been very helpful with us, and after the meeting I can share with you guys what that is, but there's an issue in our community that we're writing a law around, so,
great.
Yeah.
So if that's okay with the health committee, then I'll have Luann come to the next health committee meeting and do a presentation to you for adult protective services, and then Bill, if you let me know what you would like at the county, and let me know what you want at the county board level. And
I think that would be better between you and Kyle. Better decided that way. And if you might include Troy also in that. It sounds like he's somewhat on the mend, so. I mean, in his absence, I'd be glad to offer, but the main thing for the county board level would be with Kyle, and work that out, see what he thinks would be desirable.
thank you.
Anything else, Dee?
That's it.
Any questions?
I have one more question
for
for you.
Dee?
And this is a tough one.
Okay.
Because I've had people ask, so I thought I'd just ask you. Because you guys do the family case management, the Healthy Families Illinois, the WIC program, so you have all this information about these families, their addresses, their health records, their social security numbers. So a question that I've been asked many times in the community, when the county we sent our computers off for this forensic investigation, is all of that information on those computers that went out, and is that a HIPAA violation?
I don't think that it is, and I'll tell you why.
Okay.
Because the state of Illinois has what's called a cornerstone system. And the cornerstone systems are state of Illinois owned and controlled computer systems. So our cornerstone computer systems are where all of the WIC, HFI, and family case management data goes into. The cornerstone system is not linked to other people's computers. Now, people who have a cornerstone computer can also get on the internet, but the cornerstone system takes that data and it goes into a state network, not into our network. So I'm not an IT person. That's probably a good question for for an IT professional. But I don't think that that information was retrieved. I don't know that. I really don't know that. So I guess the honest answer is I don't know. But we don't even have IT work on the Cornerstone computers when they were Cornerstone,
So the computer, that workstation was used to enter the data, it was saved on this Cornerstone network, but were those computer hard drives also searched? No, okay. Okay.
Thank you.
Who works on those?
The Cornerstone computer, we have a specific user, they have to go.
No, who does, if you need,
The state of Illinois, we call Cornerstone.
and they come in,
Uh-huh.
okay.
We can't even move them across the room. They have to do that. We're not allowed to reposition it.
I was going to ask it last month, but there was too much media here, so I asked it.
And then, just so that you know that, this is just additional information, that on March 30th, Cornerstone, the state has been switching from Cornerstone to what's called vStone. And vStone will be, instead of a network, it will be internet-based. And they're coming, and then the IT people are coming on March 30th to transition it from Cornerstone to vStone.
Good luck. Any other questions for Dee?
I'll shut up. Okay.
Thank you, Dee.
Thank you.
Claims. Have you had an opportunity to look over them? Are there any that you would have questions about? And I will assume, unless I hear to the contrary, that we would, in general, recommend to the Finance Committee to approve the claims on the claims list for this month. Seeing no opposition to that, I would assume we would send that recommendation on. Old business. Any old business? New business? If not, bye.